Zoom before we get started. Okay, well, if anyone joins us late, then they'll just have to catch up. So my name is Stephanie Fahuri. I am the HICAP Program Manager and Staff Attorney at Center for Healthcare Rights. I'm curious if any of you here have already heard of the HICAP program or have contacted us for any reason, have any idea who we are, what we do. No, there's a lot of blank looks in the crowd. So let me tell you who we are. Well, actually before I do that, how many of you have received a copy at some point in the past of the Medicare and You book that goes out in the fall from CMS, the Center for Medicare and Medicaid Services? Okay, so on the back, usually I have one here with me as a prop, but I forgot to bring it today. On the back of the Medicare and You book, there is a phone number. It says, call this number for local personalized assistance with Medicare. That number gets you to our agency. So I don't work for Medicare. I work for a nonprofit organization called the Center for Healthcare Rights. And we have the HICAP, we run the HICAP program for Los Angeles County. So HICAP stands for Health Insurance Counseling and Advocacy Program. And one of the things that's really important to know about our agency and our services is that we don't sell anything. We do not sell insurance. We do not try to convince you to change your coverage to one thing or another. We provide neutral, unbiased Medicare information to anyone who lives in Los Angeles County and has Medicare or is approaching Medicare eligibility. So our services are primarily funded through the City and County of Los Angeles. That money comes from the California Department of Aging. But again, we're a nonprofit organization. And I just want to highlight again, we don't sell anything. Now, I'm not saying that insurance agents and brokers aren't helpful to work with, absolutely, but they typically work with specific plans, and they might not be able to help you compare all of your options. So as we're thinking about open enrollment and trying to figure out what are my options, should I change my coverage, if I do change my coverage, what's going to happen, right? You can certainly work with an insurance agent or broker, but I strongly recommend giving us a call. Our services are free. We don't charge anything, and we can help you compare your options. Or if you have other Medicare-related issues or questions unrelated to comparing coverage options, we can also try to help with that. So our phone number is here on the slide. It's on the materials that I brought here. One of the things that I think is helpful, that I hope everyone grabs, are these teeny tiny little cards. Now you might be wondering, why would I want something that's that small with print this tiny? The goal is for you to keep this in your wallet or keep it where you keep your Medicare card so that if you run into issues, you've got our number handy. So feel free to grab one of those on your way in or out. Okay. So what are we going to talk about today? Today we are going to talk a little bit about open enrollment. We're going to talk about Part D plan coverage options. We'll talk about Part D costs and also the Extra Help program. Now, one thing I want to highlight, so today is September 12th. Open enrollment doesn't start for another month. It starts on October 15th. So some of the numbers that I have on the slides for, some of the costs, the deductibles, we'll get to that information, but I don't have the information yet for 2024. That information has not yet been released. They will announce it in the next couple of weeks before open enrollment starts. So some of the slides here you'll see, oh, 2023, well, if I'm trying to make a plan for next year, how do I know? Feel free to call us, once that information becomes available and we can talk you through it. So first, what's open enrollment? You might think of it as the time of year that your mailbox is overflowing with random garbage from a number of different health insurance companies. It might also be the time of year that you are nervous to turn the TV on because of the number of television ads telling you that you need to sign up for this plan or another. Open enrollment, October 15th to December 7th, is the time of year that everyone who has Medicare can make a change to your prescription drug coverage through Medicare. That could mean changing your standalone prescription drug plan. It could mean changing a Medicare Advantage plan that includes prescription coverage. This time of year is not necessarily for signing up for Medicare for the first time. It's really the time of year to look at your options for the upcoming calendar year with respect to your drug coverage, or if you're in a Medicare Advantage plan, comparing those options. Any change that you make during open enrollment becomes effective January 1st. So at other times of year, it might be a different, it might be effective the first of the following month, but when we're talking about open enrollment, we're really looking at the next year. You're making a decision for your coverage for the following calendar year. So, as I mentioned, we have two main ways to get prescription drug coverage through Medicare, right? So you hopefully already have Medicare Part A, which is the hospital coverage. Medicare Part B covers your outpatient doctor visits, emergency room, preventive services, durable medical equipment, stuff like that. Part D is the prescription drug benefit. D stands for drugs. That's pretty easy to remember. That's the one that's easiest for me to remember. D stands for drugs. You may also be wondering, why didn't she mention Part C? Part C refers to Medicare Advantage. So we'll go through the differences for these two options. But when you have a standalone prescription drug plan through Part D, you'll continue to use what's referred to as original Medicare, that red, white, and blue Medicare card for your A and B services, whereas with a Medicare Advantage plan, you are assigning all of your Medicare coverage to a private insurance company who then administers all of the benefits together. So we'll talk a little bit more about that. For my more visual learners, this is what that looks like, right? So original Medicare is on the, left. They're both on my right, I guess. So yes, on the left, original Medicare with the red, white, and blue Medicare card and a standalone prescription drug plan, Part D. If you go that route, the prescription drug plan only covers your prescriptions. It only impacts which pharmacies you can go to, how much you pay for your prescriptions, has no impact on which doctors you go to, because with original Medicare, it's a totally open network. You can go to any doctor or any hospital in the country that accepts Medicare. Sometimes I hear from people and they say, oh, I want a PPO. I want the flexibility of a PPO. That's not original Medicare, because even a PPO has a network. A PPO is still actually a Medicare Advantage plan. When you want the most flexibility for your coverage, original Medicare is it. However, the thing to keep in mind with original Medicare is that you typically have to have some type of secondary coverage. So that could be a Medicare supplement plan, also known as Medigap, or Medi-Cal, if you're eligible for Medi-Cal, right, for low-income individuals, Or sometimes employers will offer retiree coverage that will stand as a secondary plan. So original Medicare, most flexibility, but if you don't have Medi-Cal, it can potentially be a more expensive option because those Medigap plans can be kind of expensive. So on the other hand, here we have Medicare Advantage plans, also known as Part C. They typically cover Parts A, B, and D all together in one plan. Here in Los Angeles County, most of the Medicare Advantage plans that are available are HMOs. So an HMO, Health Maintenance Organization, often referred to as managed care, right? A managed care organization, has a more restrictive network, right? You typically have to go to doctors in that network. To go out of network, you can always pay out of pocket if you have unlimited funds, right? You can go to whoever you want if you want to pay out of pocket. But it's more difficult to get the plan to approve out-of-network services. You typically go through your primary care doctor to get referrals to specialists. You may have to have prior authorizations done through a medical group. Now that might all sound pretty negative. The thing is, there's really no one-size-fits-all Medicare coverage option because what's best for you might not be what's best for you, right? One question I get all the time is, well, what's the best plan? What should I pick? I can't tell you, right? Because it's really gonna depend on which doctors and hospitals you wanna be able to go to. It might depend partly on your financial situation, because one of the benefits of Medicare Advantage is that you don't need secondary coverage. So if those Medigap policies are really expensive and you don't qualify for Medi-Cal, one way to really lower your out-of-pocket costs can be with a Medicare Advantage plan. The other benefit of Medicare Advantage is that they often have an out-of-pocket maximum for the year. So once you reach a certain limit, the plan pays everything else. That doesn't exist with original Medicare. Another benefit of Medicare Advantage is that they offer all sorts of additional benefits that Medicare doesn't cover, like vision, right? God forbid you need to pay for eyeglasses, right? You have Medicare, or dental, right? In this country, we like to pretend like your teeth are not part of your body, so Medicare doesn't cover dental, but a lot of Medicare Advantage plans do. So I think there are a lot of pros and cons to both of these models. I can't tell you this is the best plan for you or this is the best model for you, but this is one of the types of things that our agency can help you walk through. We can help walk through these options and see what's more important to you or what makes sense for your situation. So with standalone prescription drug plan, Part D, as I mentioned already, it's not impacting which doctors or hospitals you go to. You're using original Medicare, that red, white, and blue Medicare card. You don't typically need prior authorizations or referrals. If you have original Medicare with a standalone drug plan and you want to go see a dermatologist, you can just call up a dermatologist. Hey, do you accept Medicare? Great, I would like to make an appointment. Right? It's a little different when you have a managed care plan where you might need to get a referral. But as I mentioned, one of the downsides potentially is having to pay a monthly premium to get a Medicare supplement plan. And you can't necessarily just sign up for a Medicare supplement plan whenever you want. There are pretty specific rules about when they will or will not do what's called medical underwriting, where they will review your medical history. So we can talk more about that in a bit. Okay, so if you, let's say I want original Medicare or I have original Medicare, I'm not interested in changing, it's still a good idea to compare your options every year because the plans change so dramatically each year, or your health status might change from year to year. Which prescriptions you're taking might change from year to year. So what are some of the things to consider when comparing your options? First, what's the monthly premium, right? A couple years ago, we got a lot of calls from folks that were in one prescription drug plan that, it served them perfectly fine. I think the premium was around $30-something per month. Nothing too wildly expensive, sort of middle of the road. People were happy with it. But then they got a notice from their plan around this time or later in September saying, oh, for this same plan, next year the premium is going to be $96 per month for the same coverage. Well, obviously no one wants to pay an extra $60 per month if they don't have to. So that was a situation where we helped people compare their options because those monthly premiums were going up substantially. You might also care about, obviously, how much you're going to pay for your prescriptions when you pick them up at the pharmacy. What are the co-pays, right? Those vary from plan to plan. The annual deductible. There typically is a standard deductible for prescription drug policies through Medicare, through Part D, but some of the plans will waive the deductible and charge you a higher monthly premium. So if you take really expensive medications and you're on unlimited income, January can be a really tough month if you need to meet a $500 deductible before your plan is going to kick in. So I have definitely talked to some clients who have said, you know what, I'm willing to pay a little bit more on a monthly basis for a plan that has a lower deductible or no deductible so that I can spread my costs out throughout the year instead of having to pay the deductible all in January and have like a $700 pharmacy visit. That makes sense, right? So, but again, it depends on your situation. Some medications under some prescription drug plans also require prior authorizations or they have quantity limits. There's something called step therapy for some medications where they make you try something else first, a less expensive drug first. And if that doesn't work, then they'll approve the more expensive drug. So that's another thing to compare, right? If you would rather not have to go through that process and there's another plan available that doesn't require that, that could be one thing to consider. And then, is your preferred pharmacy in network? Some people could not care less what pharmacy they go to. Oh, I live close to a Walgreens, a Rite Aid, a CVS, and there's local pharmacies. Doesn't matter. I've had other clients who have said, I will not fill my prescriptions anywhere except this one particular pharmacy in my neighborhood because they speak my language, or I've been going there for 50 years, or whatever reason. If the pharmacy is really important to you, we can help compare options to see which plans have that pharmacy as a preferred in-network pharmacy. So, that might seem silly or it might make a lot of sense. Again, it can be so personal. Now, on the other hand, Medicare Advantage plans, as I mentioned, when you enroll in a Medicare Advantage plan, also known as Part C, those are where you are typically assigning all of your Medicare coverage to a private insurance company. Medicare pays that insurance company on a monthly basis to provide coverage to you. So some examples of Medicare Advantage plans that you may have heard of, and this is not an endorsement because, as I said, we don't sell insurance and we do not endorse any specific plans, but you may have heard of Kaiser, right? Kaiser Senior Advantage is a very popular plan here in Los Angeles County. You may have heard of SCAN, AARP United Healthcare, Central Health Plan, Alignment, Blue Shield, Aetna. All of these insurance companies have Medicare Advantage plans in Los Angeles County. This year, I think we have around 80 something to choose from. So that can be pretty overwhelming. Yeah, so we're gonna talk through some of the things, again, that can help narrow down what you're looking for to make this an easier process. And again, the easiest thing would be to call us and we can help you compare compare. But if you want to compare stuff on your own, I'm going to give you some tools to do that. Again, with Medicare Advantage plans, you're typically needing authorizations, referrals from a primary care doctor. You can go out of network for emergency services. So let's say you live, here in Arcadia and you are traveling to New York to go see the Rockettes this winter. And you slip on the ice and need to go to the emergency room because you've twisted your ankle. If you have a Medicare Advantage plan here, it should cover you out of network for an emergency. However, let's say your adult child lives in New York and you're gonna go spend, 3 months there, and you decide, hey, you know what, while I'm here, I might as well go get my annual checkup and, I have, routine physical therapy. You can't do that out of network. But emergency services, they should cover you. Hopefully you won't need them. So one type of Medicare Advantage plan is called a special needs plan. These special needs plans have sort of additional criteria in order to be able to enroll. We don't talk to a lot of folks about these special needs plans because a lot of times, whether or not your doctor is in network is really the #1 most important thing. But I just want to explain really quickly. So there are chronic care plans, also known as a C-SNP. SNP stands for Special Needs Plan. There's lots of acronyms. I'm going to try to make sure that I'm not just talking in alphabet soup today. But the chronic needs plans, if you have diabetes or if you have COPD or congestive heart failure or some other heart issue, there are certain Medicare Advantage plans that are available that may provide sort of an additional network or a more robust network of doctors to treat those specific conditions. But if that's something that you're thinking about, I strongly, strongly recommend talk to your doctor before you even think about making any sort of change. So for example, if you have diabetes and you have an endocrinologist that you like and want to keep, before you would even consider making a change to your coverage, talk to that doctor and confirm what they take. So this is part of why I'm not typically going to advise someone, oh yes, switch to this, chronic needs special needs plan without talking to your doctor first. There are institutional plans for people that are living in nursing homes, and then there's also something called a dual special needs plan, or D-SNP, and those plans are specifically for people who have both Medicare and Medi-Cal. So that dual means the dual coverage, dual eligible. So again, these are just types of Medicare Advantage plans that exist. I wanted to make sure I mentioned them, but for a lot of our clients, the first step before even considering these plans is really to talk to your doctor. So, Medicare Advantage plans generally, as I mentioned, have lower copays than if you have original Medicare. Now, you probably are familiar with the idea that Medicare covers 80% of your healthcare costs, and then you're responsible potentially for 20%. That's if you have original Medicare with no additional coverage. With these Medicare Advantage plans, you're going to have a set copay amount for each service. So for example, I don't know any of these copays off the top of my head, I'm making this up, but just as an example, let's say you have Kaiser and going in, oh, it's a $25 copay for this visit, it's $50 copay for emergency room, it's $40 for a specialist or something like that, as opposed to a percentage of some unknown number. With Medicare Advantage plans, it's a set copay that might resemble insurance coverage that you may have had in the past. It more closely resembles just a regular private insurance plan. And then, as I mentioned, they do typically offer additional supplemental benefits that are not typically covered by Medicare, like dental, vision, transportation services, over-the-counter drug benefits, all of the gym membership, Got a lot of inquiries about these gym memberships. But again, does your doctor take the plan? That's more important from my point of view than does it offer you a free gym membership which you may or may not use. And I say that as someone with a gym membership that I don't use, so. Which I pay for, oh boy. Okay, so again, when we are thinking about Medicare Advantage plans, which plans contract with the doctors or hospitals you want to see? I'll give you another example of how this has presented itself in real life. So I know UCLA Medical Center is kind of far from here, but we serve all of LA County. And a couple of years ago, actually last year and the year before, we've gotten calls from individuals who get all of their medical services at UCLA. I don't know what's going on at UCLA, but the last 2 years, they have changed which plans they contract with. So I think 2 years ago, I had a client, he was in his late 80s. He had been with SCAN Health Plan for 20 years or something, and UCLA was no longer going to be contracting with SCAN as of January 1st, 2022, so he knew he had to change if he wanted to keep all of the same doctors. So sometimes changing your coverage isn't necessarily because you're unhappy or because another plan is offering you different or better benefits or is less expensive. Sometimes it's really just a matter of, I need to keep seeing my same doctors, or I want to keep seeing my same doctors, or going to the same hospital, and making a decision about that. So that's something, again, that we can help compare. Obviously, how much are you going to be paying for your services when you go to the doctor? If you know that you are seeing a specialist every single month to manage some chronic health condition, you might want to know how much that copay is going to be every single month when you show up, right? That seems important. It also is helpful for budgeting so that you can anticipate how much you might expect to pay. Will your prescription drugs be covered? There are a couple of Medicare Advantage plans out there that for whatever reason do not include drug coverage. I really don't understand why. It's very rare that I talk to someone who's in one of those plans. But that's just something to keep in mind, and then obviously you want to look for a plan that provides the best coverage for your prescriptions. And then what are the additional benefits, right? If that gym membership, I literally have had people call and say, I don't care what hospitals I go to, I don't have a doctor, I'm flexible, I'm healthy, I just want the gym membership. Okay, we can help, we can narrow that down for you. I would still recommend maybe thinking about, at the very least, even if you're super healthy, if there was an emergency, which hospital would you prefer? If you needed a hospitalization, right? Emergency, they'll take you wherever's closest. But if you needed a long-term hospitalization, would you prefer to be at Huntington Hospital in Pasadena? Would you prefer to be at Cedars-Sinai, right? Things like that I think are important to think about. Okay, so talking about Part D open or enrollment periods in general, everyone who has Medicare or becomes eligible for Medicare has their initial enrollment period. It's that 7-month period that for most people surrounds their 65th birthday. And you can sign up for a drug plan at that time. We talk to a lot of people who delay their coverage because they are working, they have employer coverage, or they have VA coverage from, for their prescriptions. There's a lot of reasons why people might delay past their initial enrollment period. We also have open enrollment, which is why we're here today. It starts October 15th. And then we also have something called Medicare Advantage open enrollment period. So in order to use the Medicare Advantage open enrollment period, which starts January 1st and goes through March 31st each year, you have to start the year enrolled in a Medicare Advantage plan. So let me give you an example. Let's say this fall, during open enrollment, you're comparing your options and you decide, hey, yeah, that gym membership sounds great. I'm gonna sign up for this Medicare Advantage plan, I'm gonna see how it goes. let's see if I like the doctors, I'm gonna try it out. And then let's say January 1st rolls around, you're in your new Medicare Advantage plan, and then later that month, or maybe in February, you try to schedule an appointment and you realize, oh no, my doctor's not in network. Or, oh no, I made a huge mistake, I don't like this plan at all. This gives you an opportunity to switch back or make another change. It used to be called the Medicare Advantage disenrollment period. I think that sort of helps clarify a little bit more about why this period exists at the beginning of the year. Because we do frequently hear from individuals who they've made a mistake, they misunderstood what they were signing up for, sometimes they're victims of fraud and signed up for something that they didn't actually ask to sign up for, right? Someone enrolled them. So you're not necessarily stuck if you start the year in a Medicare Advantage plan. You may have an opportunity to change. Now, we also have special enrollment periods for changing drug coverage. So let's say you're in the situation where you still have employer coverage because you're still working. Does that mean that you have to wait until, if you retire in May, right, do you have to wait until open enrollment to get a drug plan to start January 1st? No. If you have certain life changes, you're eligible for what's called a special enrollment period to get into a plan or change a plan sooner. Let's say you have a plan here in LA County and you decide, you know what, I'm gonna move to Lake Tahoe. Well, that's probably not the same coverage area as your current plan, right? Because first of all, it's in Nevada, right? Am I getting my geography correct? I actually haven't been to Lake Tahoe. Fingers crossed, that's correct. At the very least, it's not LA County, so you would have the opportunity to make a change to your coverage if you move out of the service area. A little closer to home, let's say you decide to move to Palm Springs and live out your retirement in Palm Springs. That's Riverside County. It's a different county than LA. That would open up a special enrollment period to change your coverage. And then entering or leaving a nursing home, that's always something that will open up a special enrollment period. And then for folks who have Medi-Cal in addition to Medicare, or just the Extra Help program on its own. Extra Help is a program through Social Security that we'll talk about that also gives you the opportunity to change your drug coverage more times throughout the year. And I think the reason that they allow that is because the assumption is that people on Extra Help may have changing prescriptions, there might be less expensive options available so that you can change more frequently. So you can typically, if you have Extra Help, you can change once per quarter, potentially. I don't recommend changing once per quarter unless it's really necessary, because sometimes it can get really confusing about what even is my coverage. Okay, so enrollment in a Part D plan technically is voluntary. No one's gonna force you to sign up for a drug plan. I have had clients who have told me, I don't believe in taking prescription drugs. I am never gonna take prescription drugs. I don't want Part D. That's their choice. And if they never sign up for Part D, they will never get a penalty. But maybe something changes 10 years from now, right? And they realize, oh, I'm sick and I need to take medications and I don't want to pay out of pocket. Oh, I've heard about Medicare open enrollment. I'm going to try to sign up for a plan now. There are late enrollment penalties. So any month that you should have had Part D coverage but don't, and then you sign up for a plan, they will penalize you. It's not a massive penalty, but it's a lifetime penalty, so it can add up a lot. It's typically, so it's 1% of the national sort of average premium for each month you're uncovered. So if the national base premium this year is about $32, about $33, the penalty is about 33 cents for each month you go without coverage. It doesn't sound like a lot, but if you go a whole year without coverage, that's like $4. And then if $4 gets added to your monthly premium for the rest of your life and you live another 25 years, that could be a lot to pay in penalties. So we like to help people avoid penalties if at all possible. So I've sort of already alluded to this, but Medicare Part D, or drug coverage through Medicare, is not mandatory if you have other coverage. So if you have what's referred to as creditable drug coverage, which is drug coverage that's just as good or better than the Medicare prescription drug coverage, you don't need to sign up for Part D. So some employer retiree plans offer prescription drug coverage. You might not ever need to sign up for a drug plan if you have retiree coverage that offers it. For example, my mom is a retiree of the state of Michigan. She has very good benefits. It's a Medicare Advantage plan sponsored by the state of Michigan that includes the prescription drug coverage, so she never has to sign up for something separate. But a lot of times when people are working and covered by an employer plan, either through themselves or through their spouse, that is considered creditable coverage, but then once you stop working or retire, you lose that coverage, and that's when you can sign up for a Part D plan. You don't typically need to have two types of prescription coverage at the same time. They don't work together. So it's usually one or the other. I mentioned veterans benefits. If anyone here is a veteran and has VA drug coverage, I think you have 0 copays, and it's a very, very good drug coverage. I've heard from a lot of veterans, they're like, why would I ever sign up for Part D? This is easier, they send it to me in the mail, it's no problem. So if you have VA drug coverage, you do not need Part D. So back to the question, do I need to change my coverage every year? Do I need to change my plan every year? Do I need to compare my options every year? I read something a couple years ago that it was a really high percentage. This is not a great story because I can't remember the precise percentage, but it was over 70% of Medicare beneficiaries pick a coverage option when they turn 65 or when they join Medicare for the first time, whenever that is, and then never compare anything and never make a change. And for some people, that might work perfectly, right? Especially if you have an employer retiree plan, or you get lucky and nothing really changes with your coverage or with your health status. But going back to that those 2 examples I shared, right? What if a hospital or doctors that you go to stop contracting with your plan? And if you don't make a change, you're gonna have to find only doctors, right? Or what if your prescription drug plan goes up by $60 per month and you don't consider other options? Well, you'll still have coverage, but maybe you're overpaying substantially and there could be a less expensive option. We don't sell insurance and we are very neutral, but if we can, we like to help our clients save money so you can spend it on other stuff, right? Nobody wants to pay $90 for a prescription drug plan. Take that money and go out to dinner, do something nice. So plans can change. The other thing is that a lot of plans come and go. They leave the market, they enter the market. I've been with the HICAP program for about 4 years, and in the 4 years I've been with the agency, I've seen a lot of changes every year with these prescription drug plans. So it's a good idea to keep an eye on your mail, especially at this time of year. Your plan, if it is making a change, they will send you something in the mail. Or if you've opted out of mail, check your email, right? However you get your communications from your drug plan or Medicare Advantage plan, keep an eye out for something from them within the next month, because they're required to notify you if the premiums are changing. They're required to notify you if they are changing which prescriptions they cover, right? What their formulary is. That's the list of the prescriptions that they cover. So it's called the annual notice of change. It's supposed to go out at the end of September. If you haven't received it by the time October 15th rolls around, you might want to call your plan and double check what's going on. Are there changes, right? Or you can call us and we can help you sort that out. And then, yeah, as I mentioned, you really want to make sure you're getting the best coverage at the lowest cost. It really breaks my heart when I see people overpaying for their prescription drug coverage when I know that they're already, on a fixed income and they could be spending that money on other things. Maybe things that are more fun. Okay, so how to select a Medicare Part D plan. I'm just looking at the time here. Okay, good. So the tool that we use is the same tool that is available to all of you. It is the Medicare.gov Plan Finder search tool. I'm curious if anyone in the room has attempted to use the Medicare.gov search tool before. There are some times where it seems so easy and straightforward, and other times, depending on what prescriptions you're taking and the dosage, if it's not a standard dosage, sometimes it can be a little bit more tricky to run the tool, but it's literally on the Medicare.gov website. That's the main Medicare website. You can set up a Medicare.gov account for yourself, and that can be a way for you to get all sorts of information about your, the claims that have been submitted on your behalf. It's also a way for you to save your prescription drug list and run this search. So you can do it without logging in. That's how we do it. We don't set up accounts. We don't log in on anyone's account for them. We don't cross that line. But if you're able to create an account and log in and save your list of your prescriptions, that can make it a lot easier for you to compare your options each year, right? Because then next year, your drug list is already in there. Maybe you need to update it a little, but maybe you're taking most of the same medications. It makes it a little bit easier. But on the Medicare.gov website, as we get closer to October 15th, it'll be the first thing that you see. Very, right front and center, open enrollment, compare your options, find a plan. You can compare both standalone drug plans and Medicare Advantage plans on this site. And you can toggle back and forth between those options. Once you put in your prescriptions, you can toggle back and forth. Now, let's say you are lucky enough to not take any prescriptions. You can still run the Plan Finder search tool. You don't have to enter prescriptions in, but if you do take any, it's a good idea to enter those in so that you can actually see what are the co-pays going to be, right? What am I going to pay out of my pocket over the course of 2024 for my prescriptions, plus the monthly premiums, plus potentially the deductible. So we always use the Medicare.gov Plan Finder search tool. Of course, you can also talk to an agent or broker. They might be using a somewhat different tool. They might be using the same tool. I don't really know the details of what that looks like, but I know that they typically work with specific plans as opposed to seeing all of the options available to you through the Medicare.gov site. I know this is really small, but I wanted you to just get a sense of once you've entered your prescriptions in, this is sort of what it looks like. So let me see if I have never used the, okay, it works. It's exciting. So I know it's really small, but so for example, here it says sort plans by lowest drug and premium cost here on the right side. Lowest drug and premium cost. That's the default sort. So once you enter stuff in, the first plans that show up should potentially be the least expensive options for you. So this is, what am I looking at here? Where did it go? Oh. There we go. Okay, so this is the name of the plan. We've got the monthly premium here, $4.50. The total drug and premium cost, this says $18, the deductible $505. So there's a compare option. The other thing I wanted to show you is up here in the corner, all the way here at the top. It says View 67 available Medicare Advantage plans. So if you decided, you selected Part D, standalone Part D when you ran the search, and then you're like, oh, you know what, I'm just curious, what would my costs be if I look at Medicare Advantage? You can just click that button and you can switch back and forth. But this is the tool that we use. You can compare different options, you can select specific pharmacies. There are a lot of tools to use within this Plan Finder search tool. Okay, so talking a little bit about the costs and benefits, as I mentioned, we do not yet have the numbers for 2024. So those numbers will be released in the upcoming weeks, but for this current calendar year, the standard deductible is $505, and the Part D plans varied in monthly premium anywhere from $0 per month if you have extra help, all the way up to $172 per month. The $172 per month plan is not necessarily the best plan, and it's not necessarily the best plan for you, right? So again, when you're comparing plan options for, during open enrollment, so I've had clients who said, money is no object, I'll pay whatever, I'll get the most expensive plan, right? That'll be the best one. No, it really specifically depends on which prescriptions you're taking. There could be a $30 plan that covers the same medications at even a lower copay, right? So most expensive doesn't necessarily mean best. Okay, so this year we have three main coverage, well, I guess technically four main coverage phases for Part D. The first is your deductible, right? If you have a deductible, the deductible is how much money you pay out of your pocket before the plan starts paying. After you meet the deductible, you get into what's called the initial coverage phase, where you shouldn't be paying more than 25% of the cost of the drugs. Usually it's a set copay amount. So let's say, for example, you take a really common generic drug for high blood pressure, atorvastatin. I think that's the generic for Lipitor. Cholesterol, whatever. Either way, cholesterol. Those really common generic drugs might have, you see 25%, and that seems like it could be a lot of money. A lot of times for a really common preferred generic drug, your copay might be $2, it might be $1. Some plans have a zero copay. Obviously, brand name drugs are going to be more expensive, but during that initial coverage period, typically it's a set copay amount. Maybe coinsurance where it's a percentage, but usually it's a copay. Once you reach a certain amount, this year it's $4,660, you reach what's called the coverage gap, also begrudgingly known as the donut hole. So in the donut hole, you are paying 25% of the cost, of the retail cost of the brand name or generic drug. So if you're on Eliquis, and Eliquis is $700 a month or whatever it is, during the coverage gap, you're going to be paying 25% of that $700. It's a lot of money. Once you reach another threshold, which this year is $7,400, you reach what's called the catastrophic coverage phase. Now this is something that is changing for next year. I should have updated this slide. I'm sorry that I didn't. So currently, if you're in the catastrophic coverage phase, you're typically paying 5% of the retail cost of the drug. Starting next year, once you reach the catastrophic coverage phase, you will pay $0. We're very excited about this change because in 2025, there will be a $2,000 out-of-pocket limit for Part D. So this is all related to the Inflation Reduction Act that was passed last year by Congress and signed by President Biden. They've been rolling out some of these changes for Part D over time. You may have seen something in the last couple of weeks about price negotiations for this list of 10 drugs. Eliquis was one of them. That is something I hear about from a lot of our clients, that they are on these really expensive medications. Unfortunately, that price negotiation, it's great, but nothing will be effective until 2026. So that won't change anything for this upcoming year. The one really big change for this upcoming year has to do with the catastrophic coverage phase, where you will pay $0, eliminating any copays once you reach a certain threshold. I'm not positive what that threshold is for 2024. Right, this year it's $7,400. It might be a little bit higher than that next year, but we'll have that information really soon. Okay, so if you do have Medi-Cal, you have to have a Part D plan or Medicare Advantage plan. Sometimes I hear from folks and they say, well, I love being able to fill my prescriptions through Medi-Cal because it's free. It's a rude awakening. If you have Medi-Cal for a long time and then become eligible for Medicare, and all of a sudden you have to start paying a copay for your prescriptions. It is a low copay amount because of that extra help program. $1.45 for generics this year, $4.30 for brand name drugs. Those copay amounts will go up for next year. Don't have that quite yet. But the most important thing, if you have Medicare and Medi-Cal, you have to have drug coverage through Medicare. If you don't pick a plan, the state will assign you one. And they'll assign one that has a $0 monthly premium, so you're not going to be paying anything for your drug coverage. But basically, if there's another insurance that will pay for anything related to your care, the state defers to them. Medi-Cal is what's referred to as the payer of last resort. So if Medicare offers drug coverage, you have to get that drug coverage through Medicare. Okay, so the Extra Help program, which I've mentioned now a few times, is run through Social Security. There are a lot of ways to automatically get extra help. Having Medi-Cal is one of them. If you receive SSI benefits, that qualifies you automatically for extra help. If you have one of the Medicare savings programs that I haven't mentioned yet, that's another program similar to Medi-Cal. It's run through DPSS, the Department of Public Social Services, the county office. But the only thing that those Medicare savings programs do is pay your Part B premiums. You don't get additional benefits, it just pays your premiums. Or if you don't have Part A coverage for free, because you don't have the work history, it will pay your Part A premium. If you have one of those, you automatically get extra help. You can also sign up for the Extra Help program sort of as a standalone program. So it's on the Social Security website. That's what this little screenshot is. It's from Social Security. There are different levels of extra help coverage based on your income. So this year, and again, let me give you a little sort of caveat. One other change from the Inflation Reduction Act is that next year, extra help eligibility is going to be expanded. So depending on your income, you may qualify for extra help next year, even if you didn't this year. So the partial subsidy, that's sort of the lowest amount of assistance you can get, your income this year has to be under $18.43 per month as an individual, under $24.85 per month as a married couple, and there are asset or property limits. So in that way it's different from Medi-Cal. Medi-Cal is getting rid of its asset and property limits as of January 1st. If you hadn't heard that already, let me be the one to share the good news. But the Extra Help program, because it's a federal program run through Social Security, it doesn't have the same rules that we have here in our state. So sometimes it can be easier to qualify based on some of the state rules. So again, if you have any questions or concerns about the cost of your prescription drugs, the cost of your monthly premiums. If you want to see, hey, am I eligible for any of these types of assistance programs? That's another thing our agency does. We can help people apply for extra help. We can let you know whether we think you're eligible for these programs based on the income and assets that you share with us. And it really can save a ton of money. So even with the partial subsidy, right, the lowest amount, you still get discounted prescriptions, discounted premiums, and then a lower threshold for the catastrophic coverage phase. It's really helpful even if you don't get the full benefit. So these are the 4 plans available this year for people with extra help who have a standalone prescription drug plan. These are the 4 that have a $0 monthly premium. You could sign up for another plan and have it be subsidized, but if you really want to maximize your cost savings, these are those 4 plans. This list changes every year. So they will let us know in the next couple of weeks which are going to be the plans that will be available. They're referred to as benchmark plans. So all of these plans might still be in the marketplace next year, but they might not all have a 0 premium for people with extra help. So that's another thing we can help you compare. Okay, just a couple more slides. I see that we're nearing the end here, and I definitely am happy to stick around for questions, so don't worry about me rushing out the door. But one question we get is, okay, well, I'm looking at my coverage options, but there's no plan that covers all of my drugs. What do I do to get my prescription covered? Well, there's a couple of options. So if you're switching to a new plan and your previous plan covered your medications, you are entitled to what's called a transition fill, where you can get a 30-day supply as a transition into your new coverage, and that the goal is to give you time, give you a month to meet with your doctor to see if there's something else you might be able to take instead that is covered, or to try to do an exception request, which is the next option. So an exception request is where you talk to your doctor. Again, this goes through your doctor. Your doctor is the one who's prescribing the medication, is the one who is best equipped to ask the drug plan to make an exception, right? So let's say your drug plan covers all the generic drugs, but you've tried the generic and you need to take the brand name because the brand name works better for you. I've heard of this situation happening with countless clients. I know that the generic is supposed to be almost the same as the brand name, but for whatever reason, it doesn't always work exactly the same in practice for every individual. So if you're in that situation, your doctor can write a letter to the plan saying, look, it's medically necessary for my patient to take the brand name or to take, XYZ medication because she's already tried the medications that are covered by your plan, and here's what went wrong, right? She had additional side effects or symptoms, or it wasn't effective, or whatever. And so please, will you cover this one instead? It's not 100% guaranteed, but it does happen quite frequently. I talk to clients all the time who successfully have gotten their doctors to get an exception. So you're not totally out of luck if you pick a plan that doesn't cover, your specific medication, unless it's something that is completely excluded from Medicare. So a couple of examples of things that Medicare is just simply not going to cover. Drugs for erectile dysfunction, sorry, Viagra, Cialis, not going to happen. They are excluded. Compounded medications, right? Sometimes I talk to folks who they use some type of cream that's from a compounding pharmacy where it's multiple medications combined into one thing. If it's compounded, Medicare's not going to cover it. I know that there are like some drugs that are specifically for weight loss or things that are not FDA approved, right? Those are not going to be covered by Medicare. These will not. An exception request won't help you. So how long does it take to process those requests? It should hopefully take no longer than 3 days. If it's something that's urgent, they should respond within 24 hours. Okay, so the last thing I want to mention before I open it up for questions, and I have 2 slides on this, I think. Marketing fraud and enrollment fraud are real problems. And again, I know I've mentioned insurance agents and brokers a few times. I'm friendly with them, right? They're not bad people. I know that there are so many good agents and brokers out there that are really doing their best to help their clients and really, go above and beyond. Unfortunately, we also know that one bad apple spoils the bunch, right? There are some bad actors out there that really just want the commission, right? Sometimes they lie, right? And if they're lying to you, if you say, I'm interested in comparing my options, but I go to see, Dr. Smith at Huntington Hospital, I need to keep seeing her. All I care about is she in the network? If she's in the network, I'll change. We have heard from a lot of clients in recent years that they said, I want to see Dr. So-and-so. The agent or broker said, absolutely, she's in the network, no problem. They changed their coverage. Come January, oh, Dr. Smith has never accepted that insurance. If someone is lying to you to convince you to do something, that is literally the definition of fraud. That is something our agency can help with. That's part of another reason I think why that Medicare Advantage open enrollment period exists at the beginning of the year. So providing inaccurate or misleading information to convince you to change your coverage is fraud. Please be careful, right? If you see those TV commercials, or if you get those things in the flyers, and postcards, and brochures in the mail, feel free to call them for information. I'm not saying not to call. I would maybe don't call the numbers on the TV, but that's up to you. Plenty of people call these numbers and it's a totally normal interaction, right? But we do, unfortunately, I know that I'm biased, that I hear the horror stories about people changing their coverage. Oh, I was just calling for information and all of a sudden my plans changed, right? Oh, an informational call somehow turned into a sales call. If you really want to avoid that, you can call us. We're neutral. We won't sell you anything. We won't change your coverage without your permission, I promise. So we work with the Senior Medicare Patrol. They are based up in Sacramento, but they serve, Medicare beneficiaries statewide. They investigate fraud. So their phone number is here on the slide, but you can also always call us with Medicare fraud issues, and we will either assist ourselves or make the referral to SMP. Okay, so where to get information about drug plans for open enrollment? Medicare.gov, as we talked about, right? That plan finder search tool is on there, but there's a lot of really good information on Medicare.gov in general. You can also always call 1-800-MEDICARE. 1-800-MEDICARE. The customer service representatives, they might not be able to answer every single detailed question that you might have about Medicare. They'll probably refer you to us, but they can help you compare your drug plan options over the phone, and they're not trying to sell you anything. When we get booked up for appointments, because open enrollment, as you can imagine, is one of our busiest times of year. If you call us, in a couple weeks and you want to schedule an appointment for, October, that probably is fine. If you call us on December 6th, it might be a little late to try to get an appointment to speak with one of our counselors, in which case, you'll get referred to 1-800-MEDICARE and they can help you compare your options. 24 hours a day, 7 days a week. We are not available those hours, but they are. You can also, as I mentioned, call the plans directly, right? If you have a plan that you're happy with and you just want to double check, hey, is the premium changing? Oh, it's only going up by $1. Okay, great, then it's not worth my time to change my coverage. That's fine. You can always call them for information, but just be very cautious. We have had some clients who have said, I have a standalone Part D plan. I called to get information about it, and then I ended up on a sales call where they're trying to pitch me a Medicare Advantage plan sold by the same company. Just be very aware that some of these companies sell both types of policies. They're always trying to make some money. So again, you can call us, our number's here, it's on the flyers that I've provided, it's on the little wallet card. Again, if you have friends or family that have questions about Medicare, we provide services in all sorts of languages. We have staff that are bilingual in Spanish, Japanese, Chinese, and then for other languages, we use a language line for interpretation, real-time interpretation. So Armenian, Russian, Thai, whatever, we can make it work regardless of which language you need. Okay, so thanks for bearing with me. I know I went over a little, it's a lot of information, but I'm happy to answer any questions that there might be. Hey, Betty. Yeah.
Question. There is a program they advertise on the TV, Single Care. Probably you have heard about it.
So the question was, there's a program that they advertise on TV called Senior Care.
Single care for the medication only.
Single care?
Yes.
I am not familiar with single care. Yeah, I'm pretty skeptical of TV advertisements for insurance.
So this one, you go and download the app, or if you want, or if you don't want it, you can search on it, and it gives you the price of the medication that you want to buy in different pharmacies. And we have right now Medicare for my husband, and he has enrolled on the drug plan. And when I was going to CVS, I was paying for example, $40 copay. And when I searched on the Single Care, it gave me the option that I was able to choose the cheapest price. It was giving me options for multiple pharmacies. And for example, in this case, Ralph's was much cheaper, one-third of price. And I went to Ralph's and I got it. And I'm switching one by one, compare the prices. And I was asking them how it's possible, because we have same thing CVS, and I asked even CVS, can you match this price, because this is what Single Care is offering. And then they said no.
So just to confirm, when you are going to these other pharmacies, are you still using the Medicare drug coverage, or are you just paying using like a coupon?
Yeah, well, he has already the coverage. We haven't canceled it. But it seems that Single Care comes and becomes the main source. So
Yeah.
the confusing part for me is that, and that's what I want to understand. Moving forward, I understand we need to have a Part D for sure. But having that Part D, I can look at, the cheapest option, and then go by this Single Care and get his medication instead of, paying those copays.
Yeah, I'm very intrigued by, I don't know if anyone else has heard of this or used it. It sounds somewhat similar to something that I've used before, which is GoodRx. So GoodRx is a website. It's not, I don't think they have an app, maybe they have an app, but I always access it through the website where, you know, sometimes depending on if you're in the donut hole or if you're taking a really expensive prescription that's not covered by Medicare, sometimes it makes sense to look and see what's the cash price for this, and is there a coupon that I can use? You typically can't use the coupon and your drug coverage. If you have Medicare drug coverage, you're typically excluded from using a coupon. But if you don't present your drug card, so for example, I had a client who said, you know what, yes, I think similar situation. He had drug coverage, but he was taking all sorts of expensive medications, and he ultimately said, you know what, I go to Costco for this medication because it's a cheaper copay at Costco. For this other medication, I go to Ralph's. For this other medication, I go to Pavilions, right? And they might go to a whole bunch of different pharmacies and just present those coupons. The issue with that is if they're not billing your Part D plan, then you're never gonna pass the deductible. You might not get to the catastrophic coverage phase where your copays might end up being zero. So I would, if I were in your situation, I think it's great that you're looking into different ways to save money on the expensive prescriptions, but I would double check with the drug plan, were these things even billed to the drug plan or not? Because it just makes me a little bit nervous if you're sort of going around the Part D plan. That doesn't mean that it's wrong. It might be okay. But I would just double check that, especially as we go into next year and the year after, where there will be that out-of-pocket maximum for Part D at $2,000. You're gonna wanna make sure that, you know, the prescriptions are being billed to your plan so they know they can get you to that limit. So that you're not, because anything you just pay for out of pocket isn't counting towards your deductible, it's not counting towards those limits. The other thing that I want to flag is that every prescription plan, whether it's Medicare Advantage or standalone drug plan, they have in-network pharmacies, they have out-of-network pharmacies, and they have preferred in-network pharmacies. So in this situation, I don't know if maybe Ralph's is a preferred in-network pharmacy for that drug plan, whereas maybe where CVS might have been just a standard in-network pharmacy. It's wild to me how different the copays can be. I strongly recommend filling your prescriptions through a preferred in-network pharmacy. The copays will almost across the board be less expensive. So it's not even just like in-network versus out-of-network. There's that extra level of preferred in-network. So another example, SilverScript is a pretty common prescription drug plan, a Part D plan. It's owned by Aetna, which also owns CVS or vice versa. But Aetna, CVS, and SilverScript are all part of the same company. So if you have a SilverScript plan, CVS is always going to be where the copays are going to be less expensive. So it all is related. But I want to double check with you afterwards to write down the name of that app because I want to look into that more. Any other questions? Well, I know that some of this stuff takes a little while to digest. You might wake up, in the middle of the night, and, oh no, I didn't ask this question. What am I going to do? I don't understand when do I make a change, or how can I make you? Everyone has our number, right? You can call us at any time. We are in the middle of completely revamping our website to make it quite a bit more attractive and easier to use. So feel free to check out our website as well. I brought some of these flyers and fact sheets. We have a lot more on our website. So if you want to know more about Medigap, so Medicare supplement plans, we have another PDF document that you can review on our website. More information about different Medi-Cal programs, or specifically about extra help, or We have one on Medicare Advantage that has a side-by-side comparison chart of Medicare Advantage versus open enrollment. I would have brought some of those with me today, but we're also in the middle of an office move, so bear with me. But our telephone helpline works. We also have volunteer counselors that provide in-person counseling services. The person who I think is closest to here is in Duarte, at the Duarte Senior Center, and we are always looking. We're in the middle of training some new volunteers right now, but I would love to have a volunteer counselor placed here at the Arcadia Senior Center. I know that we had one in the past. So I'm going to talk a little bit to Brian, but if anyone here is interested or knows someone who might be interested in getting trained. It's a very intensive training process, as you can imagine. There's a lot of information to know, but we are really excited about having more volunteers out in the community providing one-on-one services. So if you think 2 weeks from now or 3 months from now, and you're like, oh yeah, what was she talking about? Something with volunteering. Give us a call. We're happy to talk to you about that as well. So thank you so much for joining me today. And like I said, if any questions come up down the road, please feel free to give us a call. We're happy to help you. We don't charge anything, and we are neutral. So just my final plug for HICAP services. So thank you.
Thank you.
Thank you. I have a quick question. So it's not so easy to choose a Medicare because you have to pick 3 items: Medicare, supplement, and drug plan D. That's a lot of hurdles that you have to jump through.
Yeah, it can be. It definitely can be, especially if you're one of the things that I think the calls that end up lasting the longest is the folks that are new to Medicare. Right? The idea of, oh my gosh, there's so many options. What do I do? How do I get my coverage? That's something we're here to help you walk through that process. Yeah.
And also, another thing is there's so many choices.
Right. Yes. Sure.
I have Medicare. Also, I have Blue Cross as a gap. So my question is, in case I need to visit my children, I said that we talking about maybe a year or 3 months.
So if you have original Medicare with a Medigap,
Yes.
you're all set. You can go anywhere in the country. So if your children live somewhere else, you can still go to the doctor there, and I have never spoken with someone who has original Medicare and a Medigap, where the Medigap is, where they said, no, we don't accept that. Because the Medigap pays. The doctors love that coverage. So where do your children live?
My children?
Yeah.
My children.
Oh, I thought you said that if you go to spend time with,
Yeah, my children.
yeah, and they live somewhere else?
Yeah, one is in Las Vegas, one is in New York.
Oh, okay, yeah, so in Las Vegas and New York, if original Medicare is your primary insurance coverage, and you have that Medigap through Blue Shield or Blue Cross?
Blue Cross.
Blue Cross. You shouldn't have any issues getting medical care in Las Vegas or New York. You should be okay.
And if I go on traveling, like to Taiwan. Okay.
So if you're traveling out of the country, you should double check with your Blue Cross Medigap to see if they offer any coverage out of the country. Some of them do, but Medicare does not. So Medicare will not cover you outside of the country. In Taiwan, I think they have national health coverage, right? So.
But we are not citizens.
Oh, yeah. So you may want to get travel insurance for if you're traveling outside the country, but I would also recommend before you do that, check with your Medigap through Blue Cross, because some of them will pay for some medical situations abroad.
And then if I like to move to Vancouver, okay.
Oh, if you want to move to Vancouver, and if you never plan to come back to the United States, you could drop your Medicare. But I've had some clients that, you know, oh, I moved to the Philippines for 3 years, I dropped my Medicare, and now I'm back. They end up with a late enrollment penalty. So
Medicare is for free, right?
only Part A is free.
How many of you?
Part B you typically have to pay for out of your.
Because my children take care.
Oh, that's nice. Oh, you're very lucky. You're very lucky. So yeah, it depends on the. I mean, yeah. I know that Vancouver, you know, Canada has National Health Service as well, but I don't know how you can get services if you're not a citizen.
Live there, move there, we are not citizens there, but we don't come from the
Right.
government there, right?
Yeah, I mean, Vancouver's not too far from, you know. So yeah, but I think before you move, definitely, you know, feel free to call us. We can talk you through what your options are.
Now it's not right now, so
Yeah.
it's that, okay, California now is not that good, I'm so sorry to say that. But why don't you move to Vancouver, because I came from Hong Kong when I was young. There is in Vancouver, a lot of people from Hong Kong might be, I would feel better, but I would say time different, everything is different.
Yeah.
People is different.
Yeah.
Thinking is different.
I
everything is
know, it's
different.
all so different, definitely. Well, if you do decide to make a change, feel free to call us to double check what your options are.
Yes, thank you so much.
You're welcome.
So, let me share with you.
Yeah, please. You
So-
learn so much.
So, okay, so this is going back.
Single care, okay. It was fascinating.
So,
And is it just an app, or is there also a website?
there is a website,
Okay.
so you can go also to this, like, what I can see, for example, for membership, it's expensive when I was getting from CVS and see all the prices. And this, it was the CVS that I was going always.
Interesting. And did you also enter in his prescription drug coverage into this tool, or this is just this? I think this is probably just the cash price, and those are coupons.
Yeah, and then, you know, this is my account, you know, gave me some, and then these are.
Okay, I'm definitely gonna look into this because I had not heard of it before.
Yeah, I'm not like you, I don't believe the TV advertising,
Yeah.
but I said, let me give it a try.
Oh,
And then,
sure.
like, you know, cautiously, you know, enter and look at the different things that they
Yeah.
have. So, it has like, frequently asked questions, on the
Okay.
the card, and, you know,
I'm so curious. Arcadia insurance, okay, it cannot be combined with insurance. You should try it against your insurance. So yeah, so it's either a one or the other thing. So if you're paying those co-pays, through this,
it doesn't.
it's not getting billed to his insurance. So, you know, it still might make sense for you to keep doing this if it's less expensive, but I would just be cautious going into next year and especially 2025, because there will be that $2,000 out-of-pocket maximum. I don't know if his prescriptions will ultimately cost that much, but if you're going this route, none of it's getting tallied up
To
together.
that bank.
Yeah.
So that 2,000 is the one that we pay as a co-payment, like for example, if I go to CVS, this is the money that I should pay, and then it goes to that bank, and
Exactly. So some people don't ever, you know, get to that high amount, but depending on the prescriptions,
yes,
right?
I
You know,
understand.
some of them are so expensive,
Yeah,
hundreds of dollars every month.
exactly, yeah. So far, we are not at level, but
Yeah.
hopefully it doesn't happen, but like, right now, I have the Medicare, you know, for section D, and I pay $10.
Okay. Yeah.
But he doesn't have a very major, you know, prescription. Atorvastatin, that's, you know, but these memantamine and galantamine are the main driving prices.
Got it.
over the counter, and that one is like each bottle $20, and I have to get it like at least one per month. So
Oh, yeah, that adds up. But over-the-counter medications aren't covered by Medicare, so if there's a coupon on that app, that makes a lot of sense.
yeah,
Yeah.
I don't get that much coupon for that guy, but
Anything helps, right?
but that's what I was kind of very interesting for me, and I said, it should seriously on your customer, how can you cover it? And they said, no.
Because they have to go through the plan.
Yes, yeah, so that was interesting for me.
Yeah, it's interesting for me too. I always learn so much from everyone that comes to my presentation, so thank you for sharing
Yeah,
that.
and thank you for your time, because I myself now, I'm still working, but